Objection. Question number 6, the Honourable Ruth Dyson.
Thank you, Mr Speaker. My question is to the Minister of Health. What expectations does he have for district health boards to fund patient travel costs?
The Honourable Tony Ryall.
Mr Speaker, the government expects district health boards to fund patient travel costs according to the travel policies that have been in place under the previous government, which this government is continuing.
The Honourable Ruth Dyson.
Does he expect to make more inaccurate announcements, as he did on the 29th of March when he said, quote, "The amount that patients can claim under the scheme hasn't been reviewed for more than 20 years, close quote, or had he forgotten that an additional $36 million was added to that very fund after the last review just 4 years ago?
The Honourable Tony Ryall.
Question. Mr Speaker, it's quite clear that the national government's enjoyed quite a considerable amount of positive support from New Zealanders from its announcements of improving the national travel assistance policy.
The Honourable Ruth Dyson.
Will the Minister demand a Health Select Committee inquiry, as he did when the Capital and Coast Paediatric Oncology Service was last under threat and children and their families had to travel for their treatment, or will he concede that his noise then was nothing about children and their families, but purely political?
The Honourable Tony Ryall.
Because the current paediatric oncologists are in place up until August, there is a period of time for a more durable solution to the ongoing challenge of providing the full range of paediatric oncology services at Wellington Hospital.
Nicky Wagner.
Mr Speaker, my question is to the Minister of Health. What changes, if any, have been made to the National Travel Assistance Policy under the new government?
The Honourable Tony Ryall.
Well, it's been a long-awaited, this announcement from the government, that there will be increases to the National Travel Assistance Policy. There will be a 40% increase in the mileage contribution, going from 20 to 28 cents per kilometre, and we're increasing the overnight support up to $100 per night. This is the first increase in a number of years and brings the rest of the country up to the rate paid in Auckland.
The Honourable Ruth Dyson.
How can he justify his decision to allow Mid-Central District Health Board to cancel the clinical services and mobile bus? And how can he justify the now required 100-kilometre journey on a substandard road with no travel assistance to the good people of Dannevirke? What happened to no cuts in frontline services?
The Honourable Tony Ryall.
Mr Speaker, I'm advised that the reason why there have been changes made to the Dannevirke service is to actually improve the number of patients who can get a first specialist assessment. Because what we know is that despite the population of New Zealand growing by 10% in the last 9 years, the number of first specialist assessments hardly grew. But what I can also say is that I've been advised by the Chief Executive of Mid-Central that there are 30-something plus services being provided in Dannevirke.
Nicky Wagner.
My question is to the Minister of Health. What actions has he taken regarding other vulnerable services in DHBs?
The Honourable Tony Ryall.
Mr Speaker, it's no doubt when you look at the situation of the paediatric oncology service here in Wellington that the new government has inherited a large number of vulnerable services, mainly because of the health workforce crisis that's been ignored for some years. The new government has asked district health boards to identify those vulnerable services and work regionally and nationally to ensure that frontline services can be improved.